pleasure to extend a warm welcome to each and every one of you to this momentous occasion, the signing of the Memorandum of Understanding between Ministry of Health and Family Welfare, Government of India, Government of Goa, and the Tata Memorial Centre, Mumbai, on collaboration to develop the state-of-the-art oncology facilities at Goa Medical College and Hospital. The global epidemic of non-communicable disease is creating an unsustainable burden on health systems worldwide. The most dreaded of the non-communicable disease is cancer. Cancer is the second leading cause of death globally. In our country, the estimated mortality in 2022 due to cancer was 8,08,585. With our country's burden projected to rise in the coming decade, our best hope to fight this disease is a strong healthcare system designed to improve survival rates with timely and quality healthcare facilities. Today, our state stands to gain the finest medical care and expertise in the field of oncology from stalwarts in this field, from one of the premier medical institutes in the nation, Tata Memorial Centre, Mumbai, thus providing oncology services to the people of Goa under one roof. Without further ado, I request Sri Arun Kumar Mishra, Secretary Health, Government of Goa, and Dr. Shivanand Bandekar, Dean, Goa Medical College and Hospital, to escort our illustrious dignitaries to the dais. It is said that flowers are the music of the ground. They are sunshine to the month. It is our privilege to honor our dignitaries with flowers. I request Ms. Sanjana Bandekar to present a floral bouquet to Honorable Chief Minister Dr. Pramod Sawant. I request college and hospital to address the gathering.
Good morning, everybody. Dignitaries on the dais, Honorable Chief Minister, State of Goa, Dr. Shri Pramod Samant, Honorable Health Minister, State of Goa, Shri Vishwajit Rane, Honorable Respected Health Secretary, State of Goa, Shri Arun Kumar Mishra, Respected Dean of Goa Medical College, Professor Dr. S.M. Bandekar, the Director of the Directorate of Health Services, Goa, Dr. Geeta Kakodkar, and our esteemed guests from Tata Memorial Hospital, Director of Tata Memorial Hospital, Padma Shri, Professor Dr. Rajendra Badwe, Director of Academics, Tata Memorial Hospital, Professor Dr. Shripad Banavali, Deputy Director of Tata Memorial Hospital, Professor Dr. Shailesh Shikhande, dignitaries of the dais, directors, secretaries, deans, heads of institutes, heads of departments, students, colleagues, and friends. On behalf of Goa Medical College, I extend a warm welcome to each and every one of you present here to witness this event. Honored as I feel to welcome this august gathering, it is also humbling that we are about to witness the signing of a memorandum of understanding between the Government of India, the Government of Goa, and the Tata Memorial Hospital, which will affect the lives of thousands of Goans, both directly and indirectly, in a positive manner. Cancer, as you all know, is one of the four major non-communicable diseases. According to the National Cancer Registry report of 2020, the estimated number of cancer cases in India for the year 2022 was a staggering 14,61,457, which is about 100 cases per 100,000 population, which means in India, 1 in every 9 persons is likely to develop cancer in their lifetime. Yes, it is a scary proposition, and unfortunately, it is true. When a person is diagnosed with cancer, it affects not only the person and his immediate family, but also the extended family, the work family, friends, and neighbors. When we treat a patient with cancer, it is not just performing an intricate surgery or administering chemotherapy or radiotherapy. What it means is to take care in a comprehensive and holistic manner of the person who is the patient and not just his disease. Tata Memorial Hospital, founded by Sir Dorabji Tata in the year 1941, has been the mecca of cancer care in the country for the last 8 decades. A world-class institute in itself, it has been running on the motto of education, service, and research. It has mentored and trained generations of cancer specialists in our country across the last 8 decades, including yours truly. Today, as we witness the signing of this memorandum, we hope that we at Goa Medical College will be able to bring world-class cancer care to the population of Goa through this collaboration. The 5 verticals of cancer care include preventive oncology, diagnostics, therapeutics, palliative care, and survivorship care. Preventive oncology encompasses awareness, early detection, and screening. The Government of Goa has been conducting several initiatives over the last few years in this direction. Project Satark, done in collaboration with Indian Cancer Society, helps to create awareness about oral and cervical cancer amongst the youth of the state. Another stellar initiative is the Swasth Mahila Swasth Goa initiative, where by using a smart handheld portable device called as the iBreast machine, we are able to screen women for breast cancer going into the most remote villages of the state. As of date, almost 60,000 women have been screened for breast cancer through this initiative. Tata Memorial Hospital has been leading the way not only in the country but across the world in their initiatives of early detection and screening, and we hope that with this collaboration we will learn from their expertise and their experience and bring this service to the people of Goa. Today, in the field of diagnosis of cancer, the complete and accurate diagnosis includes its subtyping at the cellular and the molecular level. Beginning from basics like cytochemistry and immunohistochemistry, cancer diagnosis today needs sophisticated techniques like DNA microarray and next-generation sequencing to be complete. This is not just to obtain a fancy diagnosis, but it is important because our therapeutics in today's era depends on this information. Tata Memorial Hospital is the front runner in cancer diagnosis in the country, and with this collaboration, we hope to avail of and to develop these facilities in Goa. Cancer therapeutics includes surgery, radiation therapy, and systemic therapy. This systemic therapy includes chemotherapy, targeted therapy, immunotherapy, stem cell transplant, and the newest kid on the block being cellular therapy or CAR T-cell therapy. CAR T-cell therapy is a very, very innovative modality of treating cancer, where cells are taken from the patient's body, they are engineered in the lab, and these modified cells are injected back into the patient. It is these modified cells which then attack the cancer cells and cure the patient. When the first successful trial of CAR T-cell therapy was published by the United States somewhere around 2012, we in India wondered whether we would ever be able to avail of this technology for our patients in our career span. But the team at Tata Hospital took it upon themselves to develop this technology, and along with a team from IIT Mumbai, they designed and set up their own CAR T-cell lab, and they developed CAR T-cells at a fraction of a cost, and within a decade started their own clinical trials in CAR T-cell therapy. At this point, I am very happy to say that 3 of our patients from Goa Medical College have been able to avail of this CAR T-cell therapy in the last 6 months. So with this MOU, we hope to share their expertise, learn new techniques, and improve patient care in our state. In India, about 50% of patients present in the advanced stage of cancer. Among those who present with the early stage, 30% have a chance of having a recurrence or a relapse. When we are unable to cure a patient, we owe it to our patients and their families to offer them the best supportive care. This palliative care can significantly ameliorate the pain and suffering of advanced cancer. In the last 5 years, the state of Goa has made considerable strides in setting up palliative care services and taking it to the doorstep or into the homes of patients through home care services. In fact, Goa Medical College, in collaboration with Directorate of Health Services, has drafted the Goa State Palliative Care Policy and submitted it to the government last month. We hope that it soon gets approved by the government so that Goa becomes the 5th state in the country to have its own palliative care policy. TMH has been the pioneer of cancer palliative care in the country, and they now run a MD course in palliative medicine. We hope that with this MOU, we can avail and benefit from their experience and their expertise. And finally, survivorship care. With improving cure rates, there are more and more cancer survivors in society, and this number is only going to increase. Cancer survivorship comes with its own set of issues. These include health issues and also issues related to psychological, emotional, and social aspects like higher education, job opportunities, medical insurance, marriage, sexuality, and fertility. Once again, Tata Memorial Hospital has been the leader in survivorship care, and we hope to learn from them through this collaboration. Since its inception in August 2018, the Department of Medical Oncology at Goa Medical College has registered 5,000 new cancer patients, which is 1,000 new cancer patients per year. In December 2018, Goa Medical College became a member of the National Cancer Grid. The National Cancer Grid is a nationwide network of cancer treating centers, research institutes, patient groups, and charitable organizations, which is formed so as to formulate uniform care for cancer patients in fields of prevention, treatment, and research across the country. With its headquarters in Tata Memorial Hospital, the NCG is another way in which Tata Memorial Hospital mentors individuals and institutions across the country. So with the signing of today's Memorandum of Understanding, we look forward to a very, very fruitful and productive collaboration. And as Dr. Banavali sir said in the first meeting of this collaboration, that Tata Hospital is not just about knowledge and technology. Tata Hospital is a culture which cares for patient, and a culture which values human life, human emotions, and human dignity. So let us hope that with this collaboration, we also imbibe this culture and we are able to give better quality care and humane care to patients in Goa. Once again, I extend a warm welcome to all gathered here to witness this historic signing of the MOU. Thank you.
Thank you, Dr. Borkar. I invite Dr. Shivanand Bandekar, Dean, Goa Medical College and Hospital, to enlighten us on this significant collaboration.
Honorable Chief Minister, Government of Goa, Dr. Pramod Sawantji, Honorable Health Minister, Government of Goa, Sri Vishwajit Raneji, respected Secretary Health, Sri Arun Kumar Mishraji, Padma Shri, Sri Rajendra Badwe, Director, TMC, Professor Sripad Banavali, Director, Academics, TMC, my friend, Dr. Shailesh Srikhande, Deputy Director, TMCH, he looks after the Tata hospitals. My colleague and friend, Dr. Geeta Kakodkar, Director, Health Services, and our own Chief Consultant, Medical Oncology, Dr. Anupama Borkar, Heads of Department, consultants, invitees, students, nursing staff, ladies and gentlemen. This is an historic day for Goa Medical College. This is basically was a dream of our Honorable Health Minister, and he always used to say that no patient should go out of Goa state for cancer treatment. And today we are witnessing this day. In days to come, down the line, I'm sure that we would be creating, as everybody says, that Tata culture and a Tata kind of SOPs for treatment, or we could say a mini Tata hospital in Goa Medical College for the treatment of cancer patients. Now this signing of MOU has some objectives in it, and these objectives are that we would run an OPD as of now along with Tata Hospital. Minimum once a week there will be an experience, or once in fortnight we will get an experience consultant from Tata Hospital for our patients. There will be expertise in medical oncology, surgical oncology, nuclear medicine, radiation oncology, diagnostic oncology, and palliative care. There will be unified physical OPD in super specialty block, where all these specialists will sit together and evaluate a cancer patient. that will be at one point the patient will be treated and he will be examined in the oncology OPD. This is a great concept. All oncology OPDs will be in super speciality block till the time our State Cancer Institute is ready. Now the Tata Hospital has promised us in this MOU to strengthen prevention, early detection, treatment and rehab, also palliation and academic programs and clinical research in state of Goa, strengthening and collaborating with existing oncology departments that is run by Goa Medical College, technical assistance for establishing medical oncology, surgical oncology, nuclear medicine, radiation oncology, diagnostic oncology and palliative care rehab, including physiotherapy for cancer patients. We will offer training and technical expertise to the faculty and paramedical staff of Goa Medical College. Conducting training programs for medical and paramedical workforce during the construction phase of to train local staff once we are on the construction phase of our State Cancer Institute. Our local staff will be trained at Tata Hospital. We will augment the cancer care by regular periodic visit of TMC faculty at least once a week, but now I heard they will be coming once fortnightly. That is also great for in a super specialty block for evaluation of cancer patients. They will also conduct virtual tumor board or teleconsultations for the patient. We will have to work out this program with Tata Hospital. And I'm sure the main objective is to give a very comprehensive care for people of Goa, which is a dream that government of Goa has been looking forward. On this historic day, I would make a small request to our Honorable Health Minister that, sir, as far as possible, we should start a nuclear medicine department in Goa Medical College, including PET CT scan. I know yesterday you have promised on the floor of the House, and this will add a feather in your cap for making this facility. And I'm here very proud to announce that National Medical Commission has given us an LOP to start DM in medical oncology in Goa Medical College. This will add to a big academic achievement for Goa Medical College. And very soon, with the help of Tata Hospital, we will achieve this academic milestone. So, with these few words, I would wish the staff whom I am representing and the government of Goa a very successful years to come out after the signing of this MOU. Thank you.
Thank you, Dr. Bandekar. Dr. Shailesh Shrikande is Deputy Director of Tata Memorial Hospital and Head of Cancer Surgery. He is also Chief of Gastrointestinal and Hepatopancreatobiliary Surgery. He has over 2 decades of experience with special interest in pancreatic cancer surgery. He has conducted several live surgical demonstrations of pancreatic, gastric, colorectal, and gallbladder cancer surgeries across India in an effort to make surgeries more accessible to the common man in a standardized fashion. In 2021, he was awarded the prestigious honorary fellowship of the American Surgical Association. Dr. Shrikande, it's an honor to invite you to address the gathering.
Thank you so much for the pleasure and privilege to be here. Honorable Chief Minister, the Health Minister, dignitaries on the dais, as well as all of you assembled here. Goa evokes different emotions, and Goa has been a beautiful place always, we all know that. But more importantly, Goa has been very well known for its rich culture, its poetry, its art, and its contribution to India. On this background, what one wants in a modern day India is to have a civil and an advanced society which perhaps has the foundations on 5 pillars: a good judiciary, good law, engineering development, medical development, and of course art. On this background, when we hear all the statistics of the previous speakers, we realize that we are on the cusp of facing a cancer epidemic. We are perhaps in the midst of it, and whether we like it or not, for the next 2 decades, if not more, we are going to see an exponential rise in the incidence of cancer. In a modern society, it's a pity that a lot of people have to travel long distances to get the basic of cancer care and specialist care. But we are merely 45 minutes away from Goa by an aeroplane. Goa has 2 airports now. So I think it's a commitment of Tata Memorial, where we have always decided to try and see that a patient can get care closer to home, that when Dr. Badwe and his vision has taken us to various different parts of the country, from Banaras to Guwahati to Visakhapatnam and Punjab, that we must have good collaboration with the state of Goa and the people of Goa. We do treat a lot of patients. I have a lot of friends here. I have come here to personally operate at Goa Medical College way back in 2014. We have a number of students who have been very well trained in Tata, and many of them are already practicing in Goa. Unfortunately, as is the case in many parts of our nation, a number of them are not working in government institutions. A large number of them, or a majority of them, end up working in institutions which are not government and in private or corporate hospitals. But I think we all know and we all appreciate that the vast majority of population accesses government medical colleges and government hospitals, and that's where our focus would be, to try and enhance this collaboration. The Dean has already told you very clearly the kind of collaboration we are going to look at. I think I will try to convince Dr. Badwe that we will have a doctor every week. I just calculated that we have 50. I don't know whether he will get convinced. He's not clapping, but I will try. But the point is, we have 52 weeks, and that means we have to look at 52 specialists, or maybe 26 specialists in the various departments that you spoke about. The purpose is not to come to Goa for the nice food and the good feeling that one always has when you come to Goa, but to actually work with you and work with your colleagues. The whole philosophy is to enjoy work. Work should be a holiday. Work should be passion. Work should be dedication. And hopefully we will be able to do that in a good way, so that we can exchange and learn ideas from our colleagues in Goa, to the point that we can bring that work culture that we spoke about. I think the most important thing, honorable ministers, is going to be ensuring how we can attract a superb, dedicated workforce who wants to work for the government and be in the government institutions. I have been a fortunate one to have been mentored and led by someone like Dr. Badwe, to spend 2 decades of my work in a place like Tata Memorial. But I think we need hundreds of doctors who would want to work in government institutions, because the talent is there, the intelligence is there, the vast majority of patients are going to come there. We just need to see how to attract them and retain them. The work culture and everything that needs to be done, surgical, medical, radiation oncology, so on and so forth, especially preventive oncology and developing a registry. I think Indians, everybody wants to today talk about artificial intelligence. But do you know what is artificial intelligence? Artificial intelligence is based on the data that we create. And India, which is such a rich country, perhaps the richest country in the world in terms of its history and culture, does not keep data very well. You see many of the Western countries, they have so much of culture and history, but they make a big story out of it. And we have so much of culture and history and we disregard it. Why do I talk about this? Because even in the world of medicine, the more data we have, the more we will be able to organize our services. And that's going to be the goal when it comes to developing a cancer registry, establishing preventive oncology along the way, and then of course we would be coming on a very routine basis to try and take this collaboration to the very best level that we would be very proud of. With these few words, I thank you for your kind attention, and a real pleasure and privilege on behalf of Tata Memorial Hospital to develop this collaboration and look forward to the time ahead. Thank you.
Now, let us watch a short walkthrough video of the cancer OPD at the new super specialty block. That was surely a very impressive cancer OPD. Dr. Rajendra Badwe is director of the Tata Memorial Center, Mumbai. He has worked in cancer treatment, education, and research for over 3 decades and has been instrumental in transforming cancer care in India. He was awarded the Padma Shri in 2013 for his contributions to the field of medicine. He has contributed to public health initiatives for cancer control and advocated against tobacco, which has led to bans on chewed tobacco in several states of India. Dr. Badwe, it's a privilege to invite you to address the gathering.
Thank you. It is indeed a pleasure to be here in Goa, and I'm happier that I may come here again and again, maybe sometimes once a fortnight also. So Honorable Chief Minister, Honorable Health Minister, the Secretary, Health Secretary, the members of the Department of Health Services, and friends. Nothing works without what we call Rajashray. So unless the Rajashray is available, and that you have very available in plenty from Honorable Chief Minister as well as from the Honorable Health Minister and none other than the Prime Minister of India. I read the letter that he wrote about this collaboration that's going to happen. So with a Rajashray from all sides, this endeavor has nothing else but success written on it. So I do understand that there is a lot more cancer these days. If I were to speak 20 years ago, there would be maybe somebody who had cancer, but today there is somebody in the family who has cancer. And no family is an exception. That's the price that we pay for urbanization. And urbanization is inevitable. When I look at the numbers from across India, rural India has numbers which are about 40 to 45 per 1 lakh population per year. That number rises to about 65 when it comes to semi-urban and rises to about 100 when it comes to metropolitan India and rises to about 350 when we go to United States. All of us are marching towards it. Fortunately, in Goa, we have what we call Subatta. So there is no rural pocket in Goa. There is semi-urban and urban pocket in Goa. So the numbers are 70 in semi-urban and 100 in urban. So in Panjim, you will have 100 per 100,000 and in rest of Goa, you might have up to 60, 70. So these numbers are higher here and no other state has this kind of activity wherein urbanization has percolated down to bring us solace in our households. But we pay a price for that, and that price is cancer. And that's the reason why I feel that we need to have services which will prevent cancer, which will diagnose cancer, which will treat cancer, which will palliate cancer, which will look at survivals as mentioned by Dr. Borkar. And I would add one more faculty to it. Within Mumbai, we had everything that just now I spoke about. And Maharashtra state boasts that nobody goes outside Maharashtra for treatment of cancer. Goa also should be like this. But in spite of that, in spite of all these being available, somewhere close to about 25 to 30% of patients dropped out from treatment in Tata Hospital. They didn't complete the treatment. So if I were to say that there is 70% cure rate in early breast cancer and 90% cure rate in children's cancer, that will happen only if they complete treatment. If 30% don't complete treatment, how will that happen? So we need that awareness. And for the last 5 years, we have run another silo to what 5 silos that Dr. Borkar mentioned. We created a batch of students called navigators. And these navigators look after not just geographic navigation, but all aspects of navigation. Emotional needs, accommodation needs, financial needs, disease-related needs, and geographic needs. All these being looked after. So I would add one more silo to that. We should train individuals like this so that everybody completes the treatment here and gets the best of the cure rates. With the newer research that is happening, I am sure Tata Hospital will share every bit with the hospitals here, and we should be able to get the same cure rates that is seen in the West, if not better, at a cost which is minuscule. Over and above that, I would go a step further and say that if we have peripheral centers delivering what is easily deliverable in addition to a hub, that will even go a long way in patients finally perceiving that somebody went through treatment of cancer And that was just a small blip in life and everything is back to normal. That's what we should be learning at, aiming at. And all this done, the aging population is rising. That itself will add to cancer, and they need a separate kind of dealing with as far as management of cancer is concerned, and all that is possible if we work together. So I strongly feel that a lot of our cancers are preventable, and those preventive episodes, if interventions, if they were to be included also, I'm sure we'll have least that should be done as far as management of cancer is concerned, and the cure rates would be extremely high. As a part of prevention and what needs to be done, I am kind of reminded of what my grandmother used to make me recite at bedtime. And I would end my talk with these words that I have recited every time at bedtime. And one of the prevention that everybody sees, the price that we pay, I said about urbanization, is obesity. So obesity is something which needs to be controlled. Obesity is related to 19 different cancers, and we need to control that. That will be dealt with separately, but I will recite what I used to be made to recite at bedtime. At 10, आईचं बोट सोडायचं. 20व्या वर्षी खेळण्याशी खेळणं बंद करायचं. 30व्या वर्षी इकडे तिकडे बघणं बंद करायचं. 40व्या वर्षी संध्याकाळचं जेवण बंद करायचं. 50व्या वर्षी बाहेरचं खाणं बंद करायचं. हे गोव्यात फार कठीण आहे. इतकी सुंदर सुंदर खायला जागा आहेत की ते कठीण होऊन जाईल. 60व्या वर्षी नवीन काही चालू नाही करायचं, आहे तेच कंटिन्यू करायचं. 70व्या वर्षी आंबट गोष्टी खाणं कमी करायचं. 80व्या वर्षी हार्ड बेडवर झोपायचं. 90व्या वर्षी आयुष्याची आसक्ती सोडायची आणि 100व्या वर्षी आयुष्य संपवायचं. थँक्यू व्हेरी मच.
Thank you, Dr. Badwe, for those very enlightening words. I now invite Secretary Health, Government of Goa, Shri Arun Kumar Mishra, to address the gathering.
आदरणीय मुख्यमंत्री गोवा सरकार, आदरणीय स्वास्थ्य मंत्री गोवा सरकार, डॉक्टर राजेंद्र बडवे, डायरेक्टर टीएमसी, डॉक्टर बनावली, डिप्टी डायरेक्टर एकेडमिक्स, डॉक्टर शैलेश, मेरे कलीग डॉक्टर बांदेकर, डीएचएस, सारे फ्रेंड जो सामने बैठे हुए हैं, आज गोवा और गोवा सरकार के लिए बहुत गर्व का दिन है। और इस गर्व का प्रमाण वो पब्लिक संदेश द्वारा जो माननीय प्रधानमंत्री जी ने हमारे प्रयासों को और गोवा सरकार के वेलफेयर मेजरमेंट के प्रयासों को एक्नॉलेज किया है, जो स्वीकारोक्ति दी है, वो हमारे लिए एक बहुत बड़ी प्रेरणा का स्रोत है। अन्यथा एक ओपीडी की खोलने के लिए देश 130 करोड़ 140 करोड़ लोगों के देश का प्रधानमंत्री यदि रिकॉग्नाइज करता है कि आप एक ओपीडी खोलते हैं और वो देश के लिए एक पाथफाइंडर बनेगा, गोवा के लिए बनेगा, तो ये गोवा सरकार के लिए बहुत बड़े गर्व का विषय है और गोवा की जनता के लिए बहुत बड़े गर्व का विषय है। ओपीडी का खुलना, टाटा के साथ खुलना एक चैलेंज भी है। टाटा एक नाम नहीं, संज्ञा नहीं, नाउन नहीं है, एक सिस्टम है और उस सिस्टम को अडॉप्ट करने के लिए हमें और सिस्टमेटिक होना पड़ेगा। इसके लिए मैं थोड़ा सा, क्योंकि एज ए स्वास्थ्य सचिव के रूप में कैसे इसको हम ग्राउंड पे ट्रांसलेट करेंगे उसका रोड मैप हमें होना चाहिए। सेम मॉडल पे 2017 में प्रधानमंत्री जी ने बनारस में उद्घाटन किया था रेलवे हॉस्पिटल में ओपीडी का, और उसके बाद 2020 में वहाँ से हॉस्पिटल फंक्शनल हो गया। आज की डेट में बनारस में 500 बेडेड कैंसर फुल फ्लेज्ड हॉस्पिटल चल रहा है। पर डे का वहाँ फुटफॉल 6000 लोगों का है, जो कि ईस्टर्न यूपी, इवन सेंट्रल यूपी एंड पूरा बिहार वो कैटर करता है, और प्रतिवर्ष 20,000 पेशेंट वहाँ आते हैं। और वो सिस्टम इतना रोबस्ट है कि रिकरिंग एक्सपेंडिचर वहाँ का 120 करोड़ रुपए पर एनम है, जिसमें 80 करोड़ रुपए टाटा कैंसर इंस्टीट्यूट और जो हमारा स्टेट गवर्नमेंट का इंस्टीट्यूट है यूपी का, वो 80 करोड़ रुपए सेल्फ फाइनेंसिंग से जनरेट करता है, जबकि वो इलाका गोवा की तरह रिच नहीं है। तो ये शो करता है कि हम वेल इंटेंडेड हों तो एक किसी सिस्टम को सेल्फ रिलायंट बना सकते हैं। एक स्वास्थ्य प्रशासक के रूप में और सरकार के प्रतिनिधि के रूप में हमारा इंटेंशन ये होगा कि कैसे हम इसको सेल्फ रिलायंट करें, जिससे गरीब की, पुअर की सेवा हो, और जो लोग बेस्ट ऑफ द बेस्ट ट्रीटमेंट ले सकते हैं, वर्ल्ड वाइड आ सकते हैं, कैंसर का ट्रीटमेंट के लिए गोवा आ सकते हैं, एक हेल्थ टूरिज्म भी के रूप में हम इसे डेवलप कर सकते हैं। जैसा डॉक्टर साहब ने अभी कहा कि हमें एक इंटेंसिव सर्वे करना पड़ेगा, टोटल मैन टू मैन मार्किंग 14 लाख 15 लाख लोगों की करनी पड़ेगी। जो आयुष्मान भारत डिजिटल मिशन स्कीम चल रही है, जिसमें हमने करीबन 5 लाख लोगों को मैप कर लिया है अभी तक, मेरा अनुरोध होगा कि हम जल्द से जल्द उसे कंप्लीट कर लें, जिससे कि इंडिपेंडेंट डिजीजेज स्क्रीन करने की बजाय जिस भी व्यक्ति की स्क्रीनिंग हो, कंप्लीट उसकी स्क्रीनिंग कर दी जाए, जिससे कि चाहे वो कैंसर की प्रॉब्लम हो, एस्नोफीलिया की हो या ब्लड रिलेटेड कोई भी इशू हो, तो हम उसको टेस्ट कर सकें। इसके अलावा माननीय मुख्यमंत्री जी हैं यहाँ पे, माननीय स्वास्थ्य मंत्री जी हैं, हम एक ऐसा वर्टिकल यहाँ पे डेवलप करने का प्रयास करेंगे जो सेल्फ रिलायंट हो, इंडिपेंडेंट हो और एक कंप्लीट इकोसिस्टम हो। उस इकोसिस्टम में डॉक्टर्स को भी हमें प्लेस करना, हमें नर्सेज को भी प्लेस करना है, हमें ट्रेन नर्सेज की भी ज़रूरत पड़ेगी, पैरामेडिक्स की भी पड़ेगी, वेस्ट मैनेजमेंट डिस्पोजल की भी पड़ेगी। तो इन सारे वर्टिकल्स पे हम एडॉप्शन मॉडल पे जाएंगे कि जो अभी तक बेस्ट इंडिया में हो चुका है, माननीय प्रधानमंत्री के नेतृत्व में बहुत सारे वर्टिकल्स काम कर रहे हैं, जिसमें कि बनारस भी काफ़ी आगे है या और भी सेंटर्स हैं। तो उस मॉडल को एज इज वेयर इज बेसिस पे हम अडॉप्ट करके शायद हमारी वो मेहनत बच जाएगी, हम आगे बढ़ सकेंगे और बनारस में भी 500 बेडेड 300 हॉस्पिटल का एक खड़ा किया जा सकेगा। तो हम टारगेट रखेंगे कि यहाँ 2 साल में काउंटडाउन वाइज करेंगे कि 2 साल के भीतर हम इसको 100 बेडेड 110 बेडेड का हॉस्पिटल हम अपना खड़ा कर सकें, जिसके लिए स्ट्रक्चरल अमेंडमेंट भी कुछ टाटा के सहयोग से किया जा चुका है और वो कंस्ट्रक्शन भी एक लेवल पे आ चुका है। फंडिंग पोर्शन भी हम कैबिनेट में जाएंगे, माननीय सीएम साहब हैं, और कैसे फंडिंग स्टैगर्ड पैटर्न होगा, क्या कोलैबोरेशन होगा। तो एंड प्रोडक्ट जो हम एंड रिजल्ट चाहते हैं वहाँ पहुँचने का जो भी रोड मैप होगा वो हम आज ही प्लेस कर देंगे, जिससे कि ये प्रोजेक्ट हमारा बीच में कहीं रुके नहीं। एक बार पुनः मैं माननीय मुख्यमंत्री जी को बहुत बहुत धन्यवाद देता हूँ कि उनकी प्रेरणा से, उनके सहयोग से, माननीय स्वास्थ्य मंत्री जी के निरंतर मार्गदर्शन में हम इस मुकाम तक पहुँचे हैं और मुझे विश्वास है कि जुलाई 2025 में शायद इसी जगह हम फिर इसके उद्घाटन के लिए आएंगे। मैं यहाँ रहूँ ना रहूँ लेकिन मुझे बुला लिया जाएगा, इस आशा के साथ आपको बहुत बहुत धन्यवाद।
Thank you, sir. This memorandum of understanding would not have been possible without the exemplary vision and guidance of our Honorable Minister for Health, Shri Vishwajit Rani. It is under his able leadership that our state has taken several decisive steps in the fight against cancer. This has brought about a holistic change in our health sector. It is his unwavering commitment and dedication to provide the highest standards of healthcare to the people of Goa. Sir, we thank you for all you do. I now call upon our Honorable Minister for Health, Shri Vishwajit Rani, to address the gathering.
Honorable Chief Minister of Goa, Dr. Pramod Sawant-ji, Secretary Health, Mr. Mishra, Dr. Badwe, Dr. Shikande, Dr. Banavali, our Dean, Goa Medical College, Dr. Bandekar, Dr. Geeta Kakodkar, Director of Health Services, Dr. Anupama Borkar, and all the respected doctors present here today, and each one of you who are present here today. The whole idea today was, I was actually very concerned because Honorable Chief Minister was busy with the assembly session, and I was very keen that this function takes place because without his support, we would have not been able to reach this particular juncture and this takeoff stage of our relationship with Tata Memorial Hospital. I would also like to acknowledge, and I am really very grateful to the Chief Minister for his total support, and also to Tata Memorial, Dr. Badwe, Dr. Shikande, Dr. Banavali, with whom we had detailed meetings in the past. Dr. Badwe and my relationship goes way back, I think more than 15-16 years back when we first met. And the reason why we are here today, and I invoke my inspiration from the support of the Honorable Prime Minister, Shri Narendra Modi ji, who has been personally monitoring, and through his office, who has been personally monitoring that we take this relationship to a different level for the people of the state of Goa. I always have been briefing the Honorable Chief Minister that this is happening, this is how it is being taken, and today I am confident with the support of the Chief Minister, we will be able to put and create that type of a Tata culture and an institute in the state of Goa that will be for the benefit of the people of the state of Goa. I want to also mention that my conversation, I was talking to Dr. Shrikande, and I keep mentioning this I wanted to mention this today, is that many times we have sent and spoken about several patients who go from Goa, who actually want cancer care, who go to Tata Memorial, and actually he has been helping us in save so many lives of people from the state of Goa who go there for the cancer treatment. I only want to say one thing. Dr. Badwe has mentioned, Chief Minister will also address us and his vision for the state. And also, Dr. Anupama Borkar has given a whole rundown on exactly what needs to be done, what is happening, and what is Tata Memorial all about. Actually, for us, this relationship is very important. I understand the importance because you see so many people who want cancer treatment who actually struggle and have to go out of the state of Goa to take cancer care and cancer treatment, which is available at Tata Memorial. Today, when we have our own institute, a relationship that we are looking for and a relationship that we are trying to forge and move ahead, taking the Tata culture ahead, I have already mentioned to Dr. Badwe in the morning, is that we want to have such a setup here in the state of Goa, and which through this MOU I think we will be able to achieve, is having the same culture, having that type of autonomous institution in the state of Goa. That will be part, the government will be part of it, but it has to be run in the professional manner in which Tata Memorial is being run today. And so that Tata Memorial also can be proud of its association with Goa, and we can make the Honorable Prime Minister proud that this is the message which we invoke and which you have sent to us today and to the government, and it is this government that is taking, headed by the Chief Minister, which is taking this initiative forward for the benefit of the people of Goa, so that the people of Goa get quality care which is available in Mumbai, which will be now available not only for the people of the state of Goa, but also for the peripheral state of Goa. We were the only state in the country, like Dr. Anupama Borkar mentioned, like pertaining to breast cancer, the type of steps that we have taken. Also, we had started a cancer registry in the past, and that day I was talking to Dr. Vinay Deshmani in Bombay. He was saying that Goa also should, even Maharashtra is still not notifiable as far as cancer is concerned, that as far as Goa is concerned, that we should actually make cancer a notifiable disease, so that whether in a private hospital or anywhere they take treatment, the main focal and central point and all the database that is managed by the government, we are able to know the actual cases of cancer in the state of Goa. And we will do it. We want to have a very active cancer registry. We want to also monitor the patients that we need to be monitored. Today, cancer is taking over many of the diseases and going at a very fast pace, like Dr. Badwe just mentioned. And we want to see that the people of Goa get the best of benefit and best of care. There is lots to be spoken, lots to be done also. As the construction of the hospital is going on at this fast pace, and we are very happy today with the message received by the Honorable Prime Minister on starting of the OPD. But my request will be to Dr. Badwe, Dr. Banavali and Dr. Shrikande is that we need to somehow see that on a weekly basis we at least have some sort of a system where we interact and take it at that level, because then the people's confidence in the system also will increase. People will also believe, in what we are trying to do for them. And let me tell you that the Chief Minister has been very proactive in giving support to every aspect. I keep briefing him, we keep taking things forward, but if this type of association where on a weekly basis we are able to have at least, if it can be an alternate week where the doctors come and specialists come here, or we can have some sort of a virtual kind of consultation with the patient, it will be of great benefit to the people of the state of Goa. Today, we have scanned so many women for breast cancer. We are scanning everybody. We are trying to see that what is not done in other states, we are trying to do it in our state. We are trying to see that the best model, and let me also make a mention to you, is that the type of cancer care that we take and the medication for cancer, each and everything is free for the people of the state of Goa, which is not the state. We have also suggested that even when you want to create a culture like Tata Memorial and create a culture like yours, we will be very frank. I would like to be when I'm here in your presence and presence of the Chief Minister, that we would like you to handhold us and take us forward exactly what is the type of culture that needs to be created. That's why creating that team right from the beginning, so we can handhold them, give them that type of exposure and take it forward, would be the main priority of the government. The reason why I asked all the doctors and all to be present here is because today cancer, like just now it was mentioned, cancer is not something that is happening to somebody else. Everybody is facing with this type of problems with their near and dear ones. And as a result of which it becomes very difficult. As far as I am concerned, yesterday in the assembly also I mentioned, Chief Minister was present, is that whenever you try to, I at least have gone through my own life experiences to come to a particular point where I do not want the people of the state of Goa to have any kind of a problem. They should have this type of health care accessible to them. And we as an institution, as a Goa Medical College and our peripheral, all doctors, Dean of Dental Colleges also here, everyone who's present here, is that we need to work as a united team to see that this mission of ours becomes a success. When it happens to somebody in your house, you realize how difficult it is to deal with the situation. It is not only giving treatment, like what just was mentioned by Dr. Badwe, that they are recruiting the people called navigators. It is very important because counseling also becomes very important. It becomes very difficult. Sometimes you deal with a patient, the patient doesn't, I was just mentioning off the cuff, something came to my mind, I was just talking to Dr. Shrikande on a particular issue. It is very difficult. One is getting appropriate treatment. Today, whether you have hormonal therapy or immunocell therapy or whatever therapy that is given by the doctor in the best interest of the patient, what needs to be done when the patient is going through that particular, it's not very easy. Managing that patient, managing the mindset, the mind of the particular person who's going through that disease, whether he is a patient from the state of Goa, is our citizen of the state of Goa, so somebody from within your house who's undergoing this, it is very difficult to deal with these type of situations. It is very tough. As a result of which we want that all of you, even I have asked the nursing today, along with our doctors, the nursing students also to be present, because tomorrow they are going to be the future. They are going to handhold. It is so important for every nurse also to play that role, which I see in certain hospitals, the type of care that they give, type of motivation that they give to the patient, and many times that helps in the patient to take one more step forward. It is very important. It is very important that all of us realize that why we are present here today. Today is a very historic moment. It is a very historic moment for the state of Goa. It is a historic moment for the people of the state of Goa that the Chief Minister, Dr. Pramod Sawantji, under his leadership and with the blessings of the Honorable Prime Minister and with the support of Dr. Badwe, Dr. Shrikande and Dr. Banawali, we are coming together to form this association, to forge come together to make this alliance, to take this forward, because we need Tata Memorial to see that people of Goa don't have to run to Bombay, but we have a proper setup within the state of Goa. Lots of work has to be done. Lots of work needs to be done. Doctors also have to become very sensitive in order to identify people if at the peripheral centers. We have to work in that particular direction so that early treatment, early detection, we are able to save people's lives. Many times, let me tell you, educated people also are trying to shy away from these type of instances, as a result of which it is not only the rural poor, or it is not only the poor who doesn't understand what is happening to him, but it is the educated people also who shy away because they are in a denial mode and they do not want to accept the fact that something is going wrong with them. And as a result of which, when it comes in the front, it comes like a absolute shock to everybody that why did this happen, and then you have no answers why it happened. It happened. And as a result of which, then your mindset has to change, and it has to change in such a manner that you have to deal with a situation which earlier, if it was earlier somebody had mentioned to you, or earlier it was detected, then perhaps you would have been in a better state of giving treatment. But tomorrow, this should not happen to the people in the state of Goa. Today, like what doctor mentioned, that it is happening in every home, it's happening in your family, it is happening to your closest people, as a result of which we have to ensure, and all the nursing students, this is my message, that's why I brought you here today, is because it is you. The nursing care today also plays a very important role along with the doctor's treatment and the doctors and what they want to do for the patient. You have to be sensitive. You have to understand that what the state of Goa is doing and what step we are taking forward today with the blessings of the Honorable Prime Minister. I always say that it's his intervention that because of which all of us are here today. I'm very happy today the Chief Minister is within us because I was feeling that there's some vacuum going to be there today because morning I realized because Chief Minister said he tied up with the Assembly and exactly when I was just thinking, I got a call from the Chief Minister that I am going to be present today for the function. This historic moment is very important as a Chief Minister of the state for the Chief Minister because the government headed by him in this MOU which we are going to sign with the Tata Memorial people of Goa will always remember this government headed by him for having this MOU in place. I can assure Honorable Chief Minister and I can assure Dr. Badwe that whatever you have in mind, this will not be run like a regular government institution. It will be run like one of your wings of Tata Memorial in the state of Goa. I just mentioned to you a few instances. Unfortunately or fortunately, I don't know what it is, but only through my own life's experience, over the last 16 years, I have 16 or 20 years, whatever instances have happened in front of me, I am talking about my own life experiences where I have had to face different situations. That is why I am so passionate about healthcare. And having a Chief Minister who is very supportive, I have been able to take and make way and do things under his leadership. Today, this stamp on the MOU in his presence only shows that the government headed by him and the blessings of the Prime Minister Narendra Modi ji, who is monitoring every step that is being taken in the state. And I think now it will be, I requested Dean to read out the message of the Honorable Chief Minister. That message is so meticulous, so well drafted, and his intention, his idea, his relationship with the people of the state of Goa, what we are doing, why Tata Memorial, why the state government, and this association is well expressed through his thoughts. I don't want to take much time. Chief Minister got the assembly to attend. I am very happy that Dr. Badwe took time and came here, Dr. Shrikande took time and came here, Dr. Banawali took time and came here, and most importantly, our Chief Minister is present with us today for this important function. Each one of you should realize that this function is a historic moment for us to move forward. People who have gone through this in their own lives will understand and appreciate what the state government is doing. People will realize that this is something historic which the government is taking forward. And the Honorable Prime Minister has also appreciated that the OPD is starting while we are constructing the hospital. Construction is in full swing. And I am grateful to him. We'll always be grateful to him for his inspiration and we invoke and we are inspired by his thought process and his vision for the people of the country and people of the state of Goa. I would like to thank all the dignitaries on the dais and the Chief Minister of the state of Goa, Dr. Pramod Sawant, for having taken time out in spite of the assembly being on and being with us today and will be present with us in the next few minutes to ink the MOU between Tata Memorial Hospital and the government of Goa. Thank you so much.
Thank you, sir, for your inspiring words. Our Honorable Chief Minister, Dr. Pramod Sawant, has always been dedicated and committed to serving the people of Goa, addressing their needs and aspirations. He has actively brought about developmental projects and initiatives to enhance the overall growth and well-being of the state. He has always supported the initiatives of the Health Department. His leadership and vision continue to shape the path of progress of our state. I now invite Honorable Chief Minister Dr. Pramod Sawant to address the gathering.
Signing of MOU between the Goa Medical College, Government of Goa and Tata Medical Center. Along with me, the Health Minister Sri Vishwajit Rani, Director of the Tata Medical Center, Dr. Rajendra Badwe, Director of the Epidemic Tata Medical Center, Dr. Sripath Banawali, Dr. Shailesh Shrikande, Dean of Goa Medical College, Dr. Bandekar, Director DHS, Dr. Gita Kakurkar, Secretary Health, Sri Arun Mishraji, and all other dignitaries among the audience. We are in the Amrut Kal of Azadi Ka Amrut Mahotsav, and our nation is marching towards achieving the vision of Vikasit Bharat 2047. With the constant visionary support of Prime Minister Sri Narendra Modi ji, Goa is scaling unprecedented milestone in the infrastructure as well as the human development. It is a moment of great pride and satisfaction that our Goa Medical College is joining hands with Tata Memorial Center for Oncology Capacity Building. As the Chief Minister of Goa and also the medical practitioners, it is my commitment to ensure adequate support for the healthcare sector. In my budget this year, I have increased the health sector allocation to rupees 2,324.65 crores, an increase in 18%. In order to ensure the ample supply of the medicine and consumable for the patients at Goa Medical College, I have made a provision of rupees 233.49 crores. This is indeed a sizable allotment, considering the small geographical size of our state. We have also planned the various measures for Goa Medical College, such as an outlay of rupees 172.19 crores for expansion, and new blood bank block with an outlay of rupees 10 crore, the construction of a respiratory medicine hospital with outlay of rupees 157.30 crores, construction of new lecture hall to cover the increased number of the students. I am sure that these measures will help to provide the world-class healthcare in the state. I am also pleased that, and we have obtained the permission from the National Medical Commissions to start with a new MD course in geriatric and immunology and hematology and blood transfusion. Under this MOU, a cancer institute will be started in the Goa to drive the sustainable growth in cancer care as per the vision of Honorable Prime Minister Narendra Modi ji, in accordance with the Pradhan Mantri Swasthya Suraksha Yojana and Ayushman Bharat Digital Mission. Under the agreement, one experienced specialist from the Tata Medical Center will attend the Oncology OPD weekly. Cancer care will be augmented by regular weekly Oncology OPDs, including the radiation, the medical and surgical care. We also conduct the virtual tumor boards and teleconsultation for research, education, and patient care. We will also establish the daycare facilities for the administration of the cancer chemotherapeutics. Even before the new cancer institution is commenced, the Oncology OPD will begin at the GMC Super Speciality Block. Tata Medical Center will offer the technical assistance to strengthen the prevention, early detection, treatment, rehabilitation, palliative care, academic programs, and clinical research. Hospital-based cancer registry will also be maintained. The steps will be taken to ensure the swift and easy referral of the Goan patient to Tata Memorial Center. The training programs will be conducted for the medical and paramedical workforce. Goa has an average of 1,000 cancer patients every year. Therefore, the efforts to train the healthcare workers and build the capacity to train this deadly disease is much needed, and it will provide a historic milestone in Goa healthcare sector. Our patients will get the best and timely medical intervention, and our students, technicians, and ancillary healthcare services will get the desired exposure to the top-class medical care and best practices. My heartfelt thanks to all of you for coming together for this noble cause, and my best wishes and speedy success for these efforts. आयचो दीस गोयच्या आरोग्य क्षेत्रातलो खूप महत्वाचो दीस आसा आणि माझ्या खातीर हो दीस खूप महत्वाचो आसा आणि तेकाच लागून बाब विश्वजीत राणे हांणी सांगले त्या प्रमाणे आज असेंब्ली चालू असताना सुद्धा हो MOU साइन करपाक हांव मुद्दामून हांगासर प्रेजेंट रावलो. म्हाका खबर आसा आमी म्हटलां तशें गोंयांत प्रत्येकाच्या म्हणजे 5 घर जर सोडले आसत जाल्यार सगळ्या घरात आमकां एखादो कॅन्सर पेशंट दिसून येता. डायग्नोसीस लेट जाता, आमी एक वेळ पेशंट हॉस्पिटला पर्यंत पावना किंवा पेशंटाक अवेअरनेस करपाक पावना. डॉक्टर बडवे हांच्यांनी जो फॉर्म्युला दिलो, म्हणजे गुड फॉर्म्युला फॉर द 100 years. आमी 100 वर्सां कशें जगपाक शकता आनी ताकाच लागून बरें जगतले जर आसत जाल्यार म्हाका दिसता ताजेर ह्या सगळ्याचेर मात करपा खातीर आमी सगळ्यांनी इट इज द प्रिव्हेन्शन, अवेअरनेस, डायग्नोसीस, ट्रीटमेंट आनी ताज्या उपरांत पॅलेटिव्ह केअर आनी बाकी सगळ्या पेक्षा सुद्दां कॅन्सरात चड म्हत्वाचें आसा. आनी त्या खातीरच हांवें म्हटलें, कारण हांवें हें अनुभवलां, लागच्यान अनुभवलां, म्हणून हें दुसऱ्याच्या घरात जावचें न्ही. म्हणजे इट इज माय रिस्पॉन्सिबिलिटी, इट इज द रिस्पॉन्सिबिलिटी ऑफ द हेल्थ मिनिस्टर अँड रिस्पॉन्सिबिलिटी ऑफ द यू ऑल पीपल. ही फक्त आमची दोगांचीच जबाबदारी न्ही आनी ही जबाबदारी टाटा मेमोरियलची न्ही. आमची कलेक्टिव्ह रिस्पॉन्सिबिलिटी आमची सगळ्यांची आसा. गोंयच्या आरोग्य क्षेत्रांतली काळजी घेवपाची आनी विशेष करून कॅन्सराच्या बद्दल आमी अवेअरनेस क्रिएट करपाची. रायटली हेल्थ मिनिस्टरान सांगलें, इट इज द नर्सिंग केअर, नर्सिंग सपोर्ट हांची तर सगळ्यांत व्हडली जबाबदारी आसा. कितलीशीच फावटी आमी पळयता की कॅन्सर जाल्लो पेशंट तेजे अर्ली डायग्नोसीस जायना म्हणून तर बाकीची सगळी कॉम्प्लिकेशन्स सातत्यात तो फेस करता. म्हणजे तुमकां सगळ्या जाणांक रिक्वेस्ट आसा की पेशंट हॉस्पिटला कडेन पावच्या पेक्षा आमी पेशंटा कडेन पावुया. म्हाका दिसता हो अवेअरनेस आमी जर सगळ्यांनी क्रिएट केलो जाल्यार अर्ली डायग्नोसीस जावपाक खूब बरें ठरतलें. आज टाटा मेमोरियल हॉस्पिटल आमच्या हांगासर आयला आमच्या लोकांची काळजी घेवपाक. आमची जबाबदारी आसा आमी पुराय गोंयच्या लोकांची काळजी घेवया. एकच जर खूब मोठ्या प्रमाणात आमी जर अवेअरनेस चलयलो म्हणजे आमकां सगळ्या जाणांक म्हाका दिसता अवेअरनेस करपाक सुद्दां आमी कॅन्सराच्यो वेगवेगळ्यो स्टेजीस, कॅन्सराची वेगवेगळी कारणां ही आमी जर सगळ्या लोकां पर्यंत सांगलें जाल्यार खूब मोठो अवेअरनेस जावपाक शकतलो. आमी प्रिव्हेन्शन करपाक शकतले, आमी अर्ली डायग्नोसीस करपाक शकतले. आयचो सायनींग ऑफ MOU विथ टाटा मेमोरियल हॉस्पिटल हो फक्त पेशंट केअर घेवपा खातीरच न्ही तर लोकां मदीं अवेअरनेस करपाकूय आसतलो. म्हाका खात्री आसा हेल्थ सेक्टरांतले म्हणजे नॉट फ्रॉम ओन्ली द गव्हर्मेंट सेक्टर बट प्रायवेट सेक्टरांतले, हेल्थ सेक्टरांतले लोक सुद्दां हो अवेअरनेस करपा खातीर आमच्या बरोबर मेळून काम करतले. आनी गोंयांत डॉक्टरान जशें आतांच म्हटलें की महाराष्ट्रांतलो एकूय पेशंट कॅन्सराची ट्रिटमेंट भायर वचपाक वचना. आज आमी प्राउडली सांगता की कार्डियक केअर सगळ्यात बरी ट्रिटमेंट जर खंयसर मेळटा आसत जाल्यार ती गोवा मेडिकल कॉलेजीत मेळटा. 2014 सुरू केल्ली कार्डियकची ट्रिटमेंट म्हणजे सगळ्या हांव पर्टिक्युलर डॉक्टरांची याद करतना बट कार्डियकांतली स्पेशली फ्रॉम डॉक्टर मंजुनाथ टू एट प्रेझेंट जे वर्किंग आशिल्ले ते सगळे दोतोर हांच्यांनी कितलेशाच जाणांचो जीव वाचयलो. आनी आज तीच परत एकदां आमी कॅन्सराच्याय बाबतींत तीच स्टेप घेता, तोच MOU आज सायन करता. आनी म्हाका दिसता फुडल्या 8 ते 10 वर्सांच्या मदीं आमी सगळे जाण कॅन्सराच्याय खंयच्याच ट्रिटमेंटाक कोणाकूच भायर वयचो पडचो ना आनी त्याच पद्दतीचो हो MOU आसतलो. त्या खातीर परत एकदां हांव आमचे आरोग्य मंत्री डॉक्टर विश्वजीत राणे आनी आमचे टाटा मेमोरियलचे सगळे डॉक्टर बडवी आनी तांची एंटायर टीम हांकां मनापासून तांचे अभिनंदन करता आनी देव बरें करूं म्हणटाय. जय हिंद, जय भारत.
Thank you, sir, for your ever-present support towards healthcare initiatives in our state. We now invite Dr. Shivanand Bandekar, Dean, Goa Medical College and Hospital, to read the encouraging letter by our Honorable Prime Minister, Shri Narendra Modi ji.
It's a very heart-touching letter from Honorable Prime Minister of India. With the kind permission of Honorable Chief Minister and Health Minister, I would like to read it for all of you. The message goes, it is heartening to learn about the construction of State Cancer Care Institute, Goa, in a joint effort by Government of Goa and Tata Memorial Hospital, Mumbai. Greetings and best wishes to the specialists associated with oncology and its allied domains, doctors, nursing fraternity, medical students, and other healthcare workers in their endeavor to serve people of Goa and the nation. It is laudable that OPD services are being started immediately, even as the hospital is being constructed. It shows the sense of service that underlines this initiative. The government of Goa has been actively working towards empowering the people across various domains, and this is another achievement in its journey. For the last several decades, Tata Memorial Hospital has been a leading institute for treatment of cancer. The work in research and awareness initiatives are also well known. The manner in which Tata Memorial Hospital has taken the lead in serving humanity, particularly the poor, is laudable. Medical science is making advancements at rapid pace, but if this progress is to be truly meaningful, it must be people-centric. This is why our government's initiatives in the healthcare sector are guided by the spirit of serving the underserved and underdeserved. We have put in place a network of regional cancer care centers, state care institute, and tertiary cancer care centers in different parts of the country. The construction of this State Cancer Institute is yet another manifestation of our vision for and commitment to the people of Goa. The effectiveness of fight against the cancer depends upon awareness, detection, and treatment. Early detection goes a long way in prevention and effective treatment of cancer. Today, about 1.6 lakh Ayushman Bharat Health and Wellness Centers offer screening facilities for such diseases, and about 30 crore people have been screened for cancer across the country. The dedicated efforts of such professionals as oncologists, radiologists, surgeons, researchers, counselors, and other healthcare workers in saving lives are commendable. By bringing many such professionals together, I am sure that the State Cancer Institute being established will not only serve the people of Goa, but it will also help to the people of the region surrounding the state. Amrit Kal is the period to fulfill the collective resolve of building a glorious, healthy, and fit India. Towards this end, it is imperative for us to emerge stronger and self-reliant in every sector, particularly in the healthcare. May the construction of the State Cancer Institute at Goa herald a new beginning in cancer care for larger benefit of people of the region and the nation. Signed by Honorable Sri Narendra Modi ji. Thank you. Thank you.
Thank you, Dr. Bandekar. This letter from our Honorable Prime Minister Shri Narendra Modi ji serves as a great source of encouragement, propelling us to do more for our state of Goa. Ladies and gentlemen, I now invite you to witness the signing of the Memorandum of Understanding between the Ministry of Health and Family Welfare, Government of India, Government of Goa, and the Bargaining Council. Ladies and gentlemen, please rise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात शुभ आशीष